So I was telling you about delusional perception. That is, it is a two-stage process in which a normal perception is linked with a delusional belief. So the first stage process is a normal process. There will be a normal perception, and it is not hallucination. That the person with schizophrenia will link a normal process with an abnormal or delusional thought. For example, when the light turns green, the person with schizophrenia will think that I am the king, or he will think that my mother is calling me. So this is what a delusional perception is called. Is it clear now?
Yes, it is. So that means like he has this delusion that this light has turned green because of him.
No, no, no. Light has turned green because not because of him. Turning the
Mm-hmm.
light is a normal phenomenon, which the patient will perceive
Right,
as normal phenomenon.
right,
So the first step is normal phenomenon. There is no involvement of the patient or whatsoever. It's neither
right.
hallucination or it's not, the patient does not think that the light has turned green because of him. The problem is
Right,
in the second step when the
right,
person link a delusional belief with a normal phenomenon,
right.
such as a turning of the light green means he's the king or his
Okay,
mother is calling him.
okay. Yeah, that's right.
Any more questions in this topic?
That's fine. Thank you.
So let's do some example. So schizoaffective disorder is when someone has schizophrenia with a mood disorder, and schizophrenia form is if symptoms of schizophrenia it lasts for 1 to 6 months. Now, a 30-year-old man thinks that the nurses are plotting to harm him and they are stealing his ideas out of his mind. So, what is this phenomena called? Stealing ideas out of his mind. What is this called? It is a thought disorder that
Uh,
is called
Withdrawal. Yeah.
thought withdrawal. Sometimes he feels that nurses can control his body. So what is this phenomena called? And he thinks that nurses can control his body.
So it's
Passivity phenomena.
pass- it's a passivity. Yeah.
And this, the person thinking that someone are plotting to harm him, this is known as persecutory delusion.
Right.
So thought phenomena or thought disorder, passivity phenomena, and persecutory delusion, they are features of schizophrenia. So the diagnosis is schizophrenia. Now, a 31-year-old man always think that when the traffic light turn red, so you can see in this example, uh, the question you are asking, that
Yes.
a 31-year-old man always thinks that when the traffic light turns red, his mother is calling him to come home. So turning the light red, he has associated a delusional belief with it. That is, he thinks that his mother is calling him to come home. So this is schizophrenia.
Right.
Delusional perception is a feature of schizophrenia. Now another example is a schizophrenic woman says that her children can hear her thoughts. So when someone falsely believes that people in the surrounding can hear their thoughts, then what is this phenomena called? Thought
Thought
broadcasting. That
processing.
is,
Yeah.
that his thoughts are being broadcasted to the outside world. Another example is a 20-year-old male hear voices telling him that he is being spied on. His speech is interrupted with silence for a few seconds, followed by a speech in a different topic. He feels he is no longer in control of his body and thoughts. So passivity phenomena is present because he thinks that he is not in control of his body and thoughts. And also, there's what is this phenomena called? His speech is interrupted with silence for a few seconds, followed by a speech in a different topic. What is this phenomena called?
So it's thought
It is thought.
uh,
Yes,
thought blocking.
yes, it's thought blocking. So thought blocking and passivity phenomena. And 20-year-old will hear voices telling him that he is being spied on. So auditory hallucinations are also present.
Persecutory delusions, like is if someone is spying, that is persecutory, or is if he's
No, no, no. You can see that a voice is telling him. He's having hearing voices that is telling him that he's spied on. Persecutory delusion remember that delusion is a false belief or a
right,
false thought in simple words. So if someone thinks that people are plotting against him, or someone think that people are spying against him, then we'll call it as persecutory delusion. And if
right,
a voice is telling him that someone is spying on him, then it will be auditory hallucination.
okay.
Now, auditory hallucination that a person hear when he is going to the bed or falling asleep, they are known as hypnagogic, hypna from sleep. So, a person, if the auditory hallucination that is heard by the patient while going to bed, they are known as hypnagogic hallucination, and the auditory hallucination that are heard while waking up, they are known as hypnopompic hallucination.
So this is also a type of schizophrenic hallucination,
Yes,
or is it
auditory
okay?
hallucination, they are present in schizophrenia.
Right.
So yes, sometimes a patient with schizophrenia, they can complain of these types of hallucination because they are auditory hallucination after all.
Okay.
For example, a 32-year-old man hears his mother calling his name only when he is about to fall asleep. So this is hypnagogic hallucination because we hear it when he is going to sleep. Now another last example. A 29-year-old lady has been suffering from intrusive thoughts. She believes that her neighbors are plotting against her. So she believes that false belief. She believes that her neighbors are plotting against her. So this is a persecutory delusion. She is convinced that she hears them planning to burn her house. She has no suicidal thoughts, but medication is helpful to treat her symptoms. So this person is having persecutory delusion, which is a feature of schizophrenia. So the treatment here will be not lithium, not lorazepam. Lorazepam will only be used in acute psychosis. If rapid tranquilization is required, then we use lorazepam. Fluoxetine is an SSRI. Citalopram is an SSRI. Quetiapine is an antipsychotic drug. So this can be used. Olanzapine, quetiapine, and risperidone. These are antipsychotic drugs that are used in the treatment of schizophrenia.
Quetiapine is same like olanzapine.
What?
Quetiapine is same like olanzapine.
Yes, quetiapine and olanzapine, they are antipsychotic drugs, atypical antipsychotic drugs, D2 receptor antagonists.
Right.
They are ending in pene, olanzapine, quetiapine. They are more commonly used than the other categories. Flat effect is sometimes also present in schizophrenia. What is flat effect? Monotonic voice with no facial expression. Persecutory delusion, it is a feature of schizophrenia. Now, a delusion of grandiosity, it is a feature of schizophrenia as well as mania. In mania, the person can have delusion of grandiosity. So it is a feature of both of the condition. Similarly, incongruent effect or mood incongruity, they are also a feature of both the disorders. Persecutory delusion is more common in schizophrenia. The question can sometimes be asked about the type of hallucination. That is, a man hears voices commenting on his actions, such as he is not getting out of bed, he is opening the door. So when someone is talking about the patient, then this is third person hallucination. Now, what are the side effects of these antipsychotic medication? As we know that antipsychotic medication, they are the D2 receptor antagonists. And we also know that in Parkinson disease, there is a degeneration of dopaminergic neurons. So in schizophrenia, dopamine are high. The activity of dopaminergic neuron is high, which leads to the symptoms of schizophrenia. While in Parkinson disease, uh, activity of dopaminergic neuron is decreased, which lead to the symptoms of Parkinsonism. So we can say that because antipsychotic medication, they are dopamine receptor antagonists, so they can induce Parkinsonism. They can cause Parkinsonism because they are basically causing a decrease in the dopaminergic activity. And a decreased dopaminergic activity can lead to Parkinsonism. Let's do an example. A 33-year-old woman on antipsychotic medication for her schizophrenia for the last 2 months presents complaining of right arm stiffness and rigidity. So rigidity is a feature of Parkinson's disease. She also has a jerky movements in the same arm. On examination, cogwheel rigidity is seen. What is the most likely cause of her symptoms? So a 33-year-old woman who is on antipsychotic medication, she developed stiffness and rigidity, cogwheel rigidity, and jerky movement in the same arm, that is resting tremor. So resting tremor, muscle rigidity, cogwheel rigidity, these are features of Parkinsonism. So we can say that a woman has developed drug-induced Parkinsonism due to dopamine deficiency because antipsychotic medications are D2 receptor antagonists, so they can cause uh, Parkinsonism. Similarly, if someone is a patient of Parkinson disease and he develops acute psychosis or agitation, then we cannot use antipsychotic medications such as haloperidol in the treatment of acute psychosis in patient with a history of Parkinson disease. So what is the treatment of drug-induced Parkinsonism? How we are going to manage drug-induced Parkinsonism? The treatment will be to stop or lower the dose of antipsychotic medication. And if not suitable, then we can give anticholinergic medication such as procyclidine. Procyclidine as well as dopamine agonists such as levodopa, carbidopa, or co-caraldopa, they can also be given. So drug-induced Parkinsonism is treated same as normal Parkinson disease. That is, either we can give anticholinergics such as procyclidine, or we can give dopamine agonists such as co-caraldopa, levodopa, or carbidopa. Now, the brain trainer. a new piece of information, but is clang association. A schizophrenic says the following: life is unfair. I eat air, lawn chair. I like pears. Pears have food. It must be good. In adulthood, I misunderstood. So rhyming, which does not have any meaning. A patient with schizophrenia, they form sentences or they rhyme like life is unfair when I air, lawn chair. So rhyming which does not have any meaning. This is known as clang association. Now, an example of pressured speech or pressure of speech. A 42-year-old woman speaks rapidly without any pause and ignores interruption. She barely even paused to take enough breaths. What is the single most best describe this kind of speech? If a person is talking continuously without any interruptions and in a hurry, then this is known as pressure speech. So this was all about today's lecture.